A viewer wrote in last week and said something I hear almost every winter. My knees always act up once it gets cold. Is that actually real, or am I imagining it? Today, I want to fact-check 3 things almost everyone believes about cold weather and joint pain, and tell you honestly which ones hold up and which ones don't. My name is Dr. Lawson, an AI-assisted educational persona. This is general educational information, not a medical diagnosis or personal advice. If you have a question you'd like fact-checked in a future video, leave it in the comments. I read every one. Let's start with the first belief. Cold weather causes joint pain. The honest answer
there
is,
it is again.
Partly true, but not for the reason most people think. Cold itself doesn't damage your joints. What seems to happen is a combination of factors. Changes in barometric pressure that often accompany cold fronts may cause tissues around joints to expand very slightly. At the same time, colder temperatures can make muscles and surrounding tissues stiffer, while blood vessels narrow, making existing joint problems such as arthritis feel more noticeable. So it's less that cold causes pain, and more that cold weather turns up the volume on discomfort that's already there. The verdict? Partly true, and there are real biological reasons behind it. Now for the second belief. If your joints hurt in the cold, exercise makes it worse, so you should rest more during winter. This one is mostly false. Movement actually helps keep joints lubricated while keeping muscles warm and flexible. Inactivity usually makes stiffness worse, especially during colder months. The key isn't whether you move, it's how you move. Gentle, consistent activity like walking, stretching, or light resistance exercises tends to help far more than sitting still and waiting for warmer weather. The verdict? Mostly false. Less movement during winter is usually the wrong instinct. One important distinction before we continue. It's common for everyday joint aches to feel worse in cold weather and then improve with warmth and gentle movement. That's generally not a cause for concern. However, if joint pain is accompanied by noticeable swelling, warmth, redness, or comes on suddenly
Medicine
and severely,
is more than just science.
especially in a
It's
single
about human
joint,
connection.
that's a different
Gentle hands guide
situation
the
and
healing
deserves
process.
prompt medical evaluation rather than trying to push through it. If you're finding this fact-check format helpful, consider subscribing. Your questions genuinely help shape future videos. Now for the third belief, and this one surprises a lot of people. Taking a hot bath or shower is the best way to relieve cold weather joint pain. The truth is a little more nuanced. Heat really can help by relaxing muscles and temporarily easing stiffness, but hotter isn't always better. A very hot bath for a long period isn't necessarily more effective than a shorter warm shower or a warm compress. For some people, especially those with circulation concerns, very hot water can lead to increased swelling afterward because blood vessels dilate significantly. A short warm shower or a warm compress followed by gentle movement is often the more balanced approach. The verdict? Mostly true, but the idea that hotter and longer always works better isn't quite right. If cold weather tends to bother your joints, here's a simple routine worth trying. Start your morning with a few minutes of gentle movement. Dress in layers that keep your joints warm. Things like knee sleeves or warm gloves can make more difference than many people expect. Then take a short warm shower instead of a long, very hot soak. Small, consistent habits usually make a bigger difference than any single quick fix. If you'd like more fact-check videos like this one, type fact-check in the comments and let me know which common health belief you'd like me to examine next. Cold weather and joint discomfort really are connected, but not in the dramatic or unavoidable way many people assume. And some of the most common beliefs about managing it simply don't match what the evidence suggests. If you found this helpful, subscribe for more evidence-based health fact checks, and I'll see you in the next video.